It's an exciting moment for a community that's been anxiously waiting for their chance to get the shot.
But those 65 and older is a large population in the state, 67,000 people eligible, and that's just in Dane County. Amanda Quintana live at SSM Health St. Mary's Hospital with how healthcare groups are prioritizing that population in different ways. Amanda?
Yes, well, in the whole state, there's about 700,000 people who are 65 years old or older. Now, of all of those people became eligible today, but Wisconsin only gets about 70,000 doses of the vaccine each week. So obviously very differing numbers there. So hospitals are trying to find a way to prioritize people to see who gets the vaccine in that group first.
I hardly felt it. That is a very tiny little needle.
That little needle has felt far away for a long time. For those 65 and older, their opportunity is finally here, but not exactly. Getting those shots in hundreds of thousands of arms will take a lot of time.
We've got about 6,300 patients that are in that over 65 category, and we're trying to match the number of people that we reach out to our capacity to do the vaccines, and also make sure that we have sufficient vaccine supply. So it's kind of a week-by-week process.
Unity Point Health Meritor is still trying to get through their employees and people in 1A, starting this new group at the same time. To break that big population down even more, they're prioritizing people at high risk.
We're just randomly selecting from people that have comorbidities.
SSM Health is taking a different approach, calling patients 75 and older first.
We have over 118,000 patients in our system alone who are 65 and up. So we knew it wasn't going to be possible for us to vaccinate everyone over 65 all at the same one, all in week one.
The health system has beefed up their capacity, able to give 20,000 doses a week.
That's all assuming we have enough vaccines. As of now, we don't.
Right now, they've been doing only about 7,000 a week. Even though all SSM employees who wanted one got one, there are still about 3,000 other community healthcare workers in line. A similar story at Public Health Madison in Dane County, but they're only getting about 1,000 first doses allocated a week.
We're just not receiving enough vaccine to keep up with the number of people that are eligible.
People without insurance will need to go through public health, asked to fill out an online survey, but it could be several weeks before any of those names get picked, with discussions about getting to communities most impacted first.
That could mean that we are looking at race, ethnicity, and then also social vulnerability. So those are some of the things that we may be using to help prioritize within the 65 plus.
Now remember, that's 700,000 people who became eligible today, and DHS still has to announce who is in that next group, Group 1B. They're expected to do that maybe this week, but that will add a lot more people onto the list of people who are eligible, and still the same amount of vaccines coming into the state.
Amanda Quintana live at St. Mary's tonight. Amanda, thank you.